And now, it's Boomer Life, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is Boomer Life on CIL 650.
Hello there, George Gordon on Boomer Life, and today we have the folks from Integrative Naturopathic Medical Center in Vancouver joining us. We're going to talk about oxidative therapies and healthy aging. We'll get an explanation about all this in a moment. First, I'd like you to meet naturopathic physician Dr. Eric Posen, along with his colleague Dr. Larry Chan. Larry, welcome to Boomer Life.
Thank you. Thanks for having us.
So, Eric, why don't you lead off and tell us a little bit about yourself?
Sure. I'm an old person. Just this year, I started collecting old age pension. How great is that?
Man, I'll tell you.
I know. It's a boon and it's sad all at the same time. But that said, I'm glad I've gotten to this point in my life and been able to still enjoy this part of my life. And I think a large part of it has to do with the work I've been doing for the last 38 years or so. First as a chiropractor and then as a naturopathic physician. And it's a type of work that I am never bored at. It can be exhausting, it can be challenging, but I am in a position in my life where every day I see people go through challenges that they've been living with for years, have it erode their spirits and their bodies, and I've seen them be able to touch on things within themselves to actually restore their health. Perhaps not to where it was when they were 20, but to at least to a place where they can be in life again and enjoy it. And that's a thrill.
Well, you don't look like you are of an age to collect the pension. You look like you enjoy life very much. So we'll be loving to hear what you have to say as we go on into the show. And Dr. Larry Chan, tell us a bit about yourself.
I'm a Vancouverite, which is born and raised here, and Chinese descent. And I think much of my process, like Eric said, is really about looking at the puzzle of health and wellness, and how do we help ourselves stay healthier, have a more vital life, and part of the process is how do we take care of myself in the process, and I draw a lot from my background as a chiropractor, naturopath as well, and Chinese medicine doctor, and really about I grew up doing martial arts as well, so a lot of it was integrating meditative practice with strong physical abilities, and also taking care of your diet. So how do we put all those things together and keep yourself healthy, and how do we translate that to the community and help people with that process as well? Right. So I think Eric and I and our other partner, Dr. Hal Brown, have been together for 30 plus years now, and I think we've done a pretty good job at our clinic, and we're excited to still be vital enough to share our new up and coming new doctors with the community, and to keep working in this capacity.
I find it very interesting that both of you have chiropractic in your background, which, if you can keep that spine straight, it can keep those nerves from getting damaged, and get all right in the spine, that you can do things to make yourself so much healthier, and that has led you into other areas of naturopathic, and in fact leading the charge that is now being accepted. From what I can see, and tell me if you think I'm wrong, that the allopathic medicine field, medical field now is starting to see the benefits too. Eric, do you see that?
Yeah, I'd like to.
He said with reservation.
Yeah, and I'm going to say that just because we make lots of assumptions in our lives, and when we use certain terms, and for instance, why are we naturopathic physicians now when we used to be chiropractors? And the reason is that as naturopathic physicians under the scope of the law in British Columbia, we can do far more than we did as we were chiropractors. But in the same voice, what we did as chiropractors set us on the stage in excitement to learn how we can look further afield to what we now know in naturopathic medicine as therapies that are useful for us. So every day I still look at people's spines and nervous systems from that perspective. And I find lots of other ways to perhaps even get at some of the problems that people have within their spine that might not always involve spinal manipulation, as an example. So from that perspective, it's a road, and it's been 30 plus years almost 40 now, in continuing that road. But that's been the exciting part of it. I think I'd like to really say lots of words about chiropractic, because chiropractic in British Columbia, and to a small degree naturopathic medicine, because they were both small professions here in the 30s and 40s, and chiropractic actually got to be licensed in British Columbia in the 30s. It really was the only bastion of another way of looking at human health and how we can survive and how we can heal ourselves. Perhaps it was misguided, but as all science, and I mean misguided from the perspective that we work from what we know at one time. So what we know about human health now is radically different from what we knew about human health 10 years ago, and certainly in the 1930s and the 1940s. The science has changed. So a lot of assumptions that we had then perhaps don't apply now. But one thing that does apply is that the human body is capable of self-healing and self-regeneration. That's what I learned as a chiropractor, and that's what I've continued to work with up to this time.
On the website, integrative.ca, Larry, you're quoted as saying, "If you are ready to embark on a journey to understanding your disease, I would be delighted to help you explore the means by which you can achieve optimal health, and my commitment to you is that I will listen without judgment." Listening is almost a lost art, it seems sometimes.
Yeah, and it's something it starts with that. I mean, it really starts when the patient comes in the door. It really is about where are they at, what's their story. If we can find out what their story is, we can actually learn to apply our knowledge and to help them find out what the next step is for their health and or their recovery. That's the key thing. So that is true. Listening is one of the most important things. And sometimes the patients will be able to tell you exactly what's wrong with them. Not just the words, but what's coming through in other ways in their expression sometimes. And if we can find that out, and we can actually hone in on that, we can make some good decisions about how can we help this person, what can we do to emphasize is the right path for them to get better.
And if they're part of that process, if it's you listening, them giving some of their own feedback, the lights come on, they're going to buy into it.
Yeah, not just buy into it, which is critical, but also just be able to accept some kind of responsibility for the process. And it is a process of a journey of being better. It doesn't just happen caused by one or two pills or one treatment.
So can I just add something
Sure.
to that about the concept of listening? Because what Larry said is critical, to hear someone, to actually sit down and hear someone. And for many times when people come, this is the first time they actually tell their story. They've run it in their heads, they've driven their families crazy with it, but they haven't actually sat down and told the story of their life. And the roots of most of the problems that we see in our office, which are mostly chronic problems, begin way earlier, in your teens, in your 20s, critical incidents that happen that defined your life. So there's the listening on the part of the physician to the story that the patient's coming, but there's another listening that happens, and this is even more important and is part of the therapy. And what that is someone actually gets to listen to themselves. Not only do they hear their voice and how they feel when they talk about their problem, but then they can actually experience in their body. There are physical sensations that happen in your body when you're well and when you're ill. And when you are ill and you can tune into what those experiences are, those are clues on how to heal it.
That is, it sounds almost too simple. If you talk about a problem that you've never talked to anybody else about, and you have somebody who listens, perhaps gives you a little feedback, you have two people who are coming to an understanding of how you got to where you are, which I guess is the starting point as to where you're going to go. They say that 65 is the new 45. Some of us are experiencing that, and I think it's true. But conversely, there are 40-year-olds who are just beat, and 20-year-olds who are just beat because they don't understand what they've done to themselves. Are you starting to see more young people coming into the clinic, or perhaps wiser older boomers who are now understanding they have to do something about it coming in and talking about what they can do?
I think there's different parts of our clinic. We have we have a very large clinic with many different practitioners as well. So we have quite a few much younger and more hip naturopathic doctors in our office. We have a traditional Chinese medicine doctor. We have, we have massage therapists and rolfers. We have all different kinds of practitioners. So our office is really, Eric is talking about chronic illnesses, and we treat a lot of that chronic illnesses. The arthritis, the cancers, the autoimmune diseases, the massive digestive issues, the fatigue issues. We deal with a lot with that. But we also see young people for athletic injuries. I treat a lot of, Eric as well, treat a lot of professional dancers and athletes as well. So we get quite a spectrum. So we treat a lot of people for acute injuries or performance enhancement. We do that as well. But it's all in the same context of what do they need? Where's the body, and where are they talking to us at that point, and what can we do to help them unravel that issue?
Yeah, I'd even add to the point that it's children.
Yeah.
Okay.
We see the most common things that parents bring their children in with are allergies, or quote unquote what those allergies may be, stomach pains, skin disorders, and depression and anxiety.
Depression amongst
Children.
children.
Children. And what's depression and anxiety? It's a feeling you have no choice in your life. And these are children who are coming to us. There's no vitality. They spend their whole days wanting to sleep. They can't go to school anymore. They have no will to engage in life.
Wow.
Where does that come from?
That's
in
pretty
someone
grim.
who's 12, 14 years age.
Where does it come from? And is that part of as the body doesn't feel well, the mind doesn't feel well, you give up hope?
Well, you can't divide mind and body.
Right.
Your body is going to respond to every state of mind you have, and your mind is going to determine how your body physically feels. For each one of those children, there's no commonality to it. There is the experience of what they have in their situations, vis-a-vis their familial situations. And then there's a wide number of biological insults that they've been heir to. Some of it might be a chronic infection. A lot of kids get hit with a mononucleosis or Epstein-Barr virus. And, it looks like within 2 to 3 months, okay, they're back on track, back at school. But no, the body could be living with a chronic virus that is slowly making compensation after compensation after compensation, and continually compromises your body's ability to utilize oxygen and live a full life.
Or it could be poor diet.
Could be poor
It's
diet.
classic. Or it could be just chronic use of antibiotics and drugs that make their body compromised over time. So
Fascinating discussion here with the good people from Integrative Naturopathic Medical Center. We're talking to naturopathic physicians, Dr. Eric Posen and Dr. Larry Chan. We're talking about aging wellness and the things that get in the way, and what can be done with naturopathic medicine that can change that. We'll be right back with more information. By the way, if you'd like more information about what we've been talking about so far, you can check it out at integrative.ca. This is Boomer Life on CIL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CIL 650.